Today on Inside Utah Politics, the COVID-19 pandemic from the front lines. State Representative and medical doctor Suzanne Harrison is here to discuss what she's seeing at work and the state's reaction. Plus, the census is underway and there's still time to make sure you are counted. We have everything you need to know to make that happen.
Time now for Inside Utah Politics.
Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We begin with State Representative Suzanne Harrison. She joins us from our backyard studio to share her thoughts on the COVID-19 pandemic. Representative Harrison, thank you so much for taking time to be with us this week.
Thank you for having me on the show, Glenn.
Yep, always glad to have you on the show, and I really wanted to get your perspective on this for two reasons. One, as a medical anesthesiologist, you are seeing this from the front lines, and two, you are also a member of the minority party up on Utah's Capitol Hill. So I want to get your thoughts here. Let's start off with what you are seeing at work in regards to this pandemic.
So Utah has done a lot of things right in terms of preparing for and having our healthcare facilities and healthcare workers be ready for this. We took a lot of precautions. I happen to work at an Intermountain Riverton Hospital, and from early on we've taken precautions to make sure that we have appropriate personal protective equipment, that we're taking precautions not only to protect healthcare workers, but most importantly, to keep patients safe. Right now, we're only doing urgent or emergent surgeries, and that means surgeries that really need to be done, or there's some threat to life or some serious consequence that can happen. But as we heard from the governor today, the governor made an announcement that we're going to start phasing in some of these other surgeries that do need to get done, but are not a matter of life and death, and we're able to be delayed for a little bit to make sure that we weren't overwhelming our healthcare system and preparing for COVID-19.
Yeah, dig into that a little more if you would, because that's what this was all about. We wanted to make sure we were not overwhelming the medical system. Is that not happening right now? Are things okay at this point?
So as a person on the front lines and as a medical doctor that is on a list of volunteers to work in the ICUs, should that need arise, I just want to thank the people of Utah and thank the many people in the state, the governor, that really took early and aggressive action to make sure that we minimize the spread of this disease. We know we have colleagues who are serving in New York City and other crisis centers right now, and we really did everything right here in terms of mitigating and minimizing the chance of a lot of people getting sick and dying. So we are not being overwhelmed in our hospital systems right now, and that's a good thing. And now we're going to be able to engage in those plans to get surgeries going and patients seen for other types of less critical care and less critical appointments and surgeries and so forth. So I fully support the governor's approach to this.
Okay, we'll get more into some of the other states' response, but I want to stick on the pandemic numbers for now. As of recording, we were over 3,400 cases, more than 280 hospitalizations, and 34 deaths. What do you make of the trends and the actual real data that is coming in day to day on this?
So I'm cautiously optimistic, and my heart goes out to the many families that have lost a loved one, or my neighbor was admitted and hospitalized for several days with COVID, and I know I have a colleague in the legislature, Representative Melissa Garth-Ballard, who lost her dad to this awful disease, and my heart goes out to everyone. But I'm cautiously optimistic about the numbers, that we are on the right path in Utah, and my strong encouragement is that we continue to listen to the medical experts with expertise in this field, the many infectious disease doctors and epidemiologists like the state epidemiologist, Dr. Angela Dunn, to continue to make those right decisions so that we keep patients and the community safe, and also that's key to being able to safely get people back to work and businesses back to work as quickly as possible.
As we look at all these numbers, they can kind of be overwhelming. We see charts, daily test rates, hospitalization rates. We see models out there, some of which appear to be projecting a worst case scenario. As we work through all this, what is the most important factor you think we really need to be watching to get a good gauge on what's happening?
Well, I think that the most important thing is that we are listening to the folks with expertise in these areas, the state epidemiologists, the folks with public health and infectious disease doctors and other medical professionals and medical doctors that know what they're talking about, and make sure they have a seat at the table as things are getting decided. We need to be very cautious that we're not just deciding things based on one factor or one issue, or one small part of the economy. We need to make sure that we're looking at the big picture so that we can safely get people back to work and businesses back to work, and also make sure patients are safe.
We've been hearing a lot about the idea lately that this could be a seasonal thing, where maybe we'll start to see it die down and then come back a little later once the cold and flu season kicks back up. What are your thoughts on that?
That is a concern, and the head of the CDC today stated that as well, that there may be concerns about a second wave, or that this becomes seasonal. And I want to say something. There's been a lot of people kind of stating that, oh, this is no big deal. This is just like the flu virus. Like, why are we being so, careful with social distancing and taking all these precautions? I just want to state very, very definitively, this is significantly more dangerous and deadly than the flu virus. This is a new virus. People don't have built up immunity over years of exposure to this virus, and we don't have a cure. We don't have a vaccine, and we don't have a proven therapy. So this is why we need to be very careful with this virus, and I want to get back to normal as quickly as anybody, and I want to cure as quickly as anybody, but we need to make sure that we're listening to the experts in their fields and working together with the various people at the table when things are getting decided, so we do this safely in the right way.
Representative, we're starting to see both state and local leaders modify their directives or orders.
Yeah.
What do you make of what you're seeing there? Are we starting to move in the right direction where we can start to loosen things up?
Yeah, and I support those careful steps that the governor is taking in terms of, letting surgeries start to happen that really do need to happen. We need to continue to be careful about social distancing, hand washing, all these kind of basic things with minimizing spread of infection. But I'm cautiously optimistic, and I think that we're heading in the right direction, and I support coming up with a plan for how we safely start to ease up on things.
You and your colleagues in a special session passed a bill expounding upon the Right to Try Act, also limiting liability and bringing in more experimental drugs. You've been a little concerned about this. Talk about why.
Yeah, so that bill, there were some really important parts to that bill, specifically offering some protections for people, for example, an ER doctor or a nurse that normally works in an outpatient clinic, that should the need arise, if our hospital systems did get overwhelmed, having some sort of protection for those folks to be able to come in and work in an ICU setting that's not their normal area of work or expertise. I think those protections in that bill were important. There were a series of amendments made to that bill that I think were critical in terms of limiting immunity for, new types of businesses offering or helping the state with distribution of unproven medications, and I think that was an important set of amendments that were made into that legislation.
What are your thoughts on these experimental drugs, though? I mean, on some level, we have had patients come forward and say, I tried this and it worked for me.
Yeah.
But what are your thoughts in trying unproven drugs at this point?
So this is where there's anecdotal examples of anything. If you just get on the internet, you can find anything about anything. And this is where I have concerns about the state coming in. You may know the state recently announced that they are going to purchase a large amount of this unproven medication, hydroxychloroquine, with taxpayer dollars. The jury is 100% out on whether this is an effective treatment. There are ongoing clinical trials to determine if it's effective. There is even some evidence out there that it's potentially harmful to patients that have COVID-19, and the FDA, along with a host of medical societies and a group of infectious disease doctors, are all urging caution. We need these medications to be studied in clinical trials so we find out if they're helpful. And I have concerns as a fiscal conservative about the state stepping in and using taxpayer dollars to purchase a large amount of unproven medication that's really not needed. We know that there is no shortage of hydroxychloroquine in the state of Utah. You already have access to this medication through normal channels. There are already patients that have access to it in our hospitals if the physicians feel it's necessary, and I think it's really unnecessary and an irresponsible use of taxpayer dollars for the state of Utah to step in and make such a large purchase.
Okay, I have a short amount of time left, but I got to get this question to you. Is it time to start carefully reopening the economy? We have about 15 seconds.
And again, this is where I think we need to make sure we have economists, public health experts, and medical experts at the table discussing this and deciding this. I think the best way to get people safely and quickly back to work and businesses back to work is to make sure we have adequate testing and that we're being led by the science and by good medicine.
Okay. Representative, we're going to have to end it on that note. Very great conversation. Thanks for joining us.
Thanks for having me.
You bet. Still to come, the census determines funding and other important community issues for the next 10 years, and the count is underway now. What you need to know to participate. But first, state parks are open for business again. How park rangers plan to make sure visitors are recreating responsibly in the era of COVID-19. We'll get to that after the break. Welcome back. Lawmakers say the CDC needs to provide a clearer picture of how the coronavirus is hitting communities of color. Early data suggests Black Americans make up a third of COVID-19 cases, but only 14% of the population. Washington correspondent Raquel Martin has more.
We need to have that information.
Michigan Democrat Senator Debbie Stabenow says to help communities hit hardest by the coronavirus, the Trump administration needs to collect more data about exactly who is contracting it.
We're just shooting in the dark here. We don't know, and that's not good enough.
So far, she says 40% of deaths in her state are African Americans.
We are seeing it in St. Louis, we're seeing it in Kansas City, we're seeing it everywhere.
Missouri Senator Josh Hawley says there's a clear racial disparity nationwide, and some areas need targeted help.
We need to search resources every place that is being hard hit.
The CDC just published a new report showing 1/3 of COVID-19 patients are African Americans, but 75% of the patient information collected is missing information on race.
Either states aren't forthcoming with the information or the CDC is not demanding it, like they should be, but it's extremely important.
Illinois Democrat Robin Kelly oversees health policy for the Congressional Black Caucus. She says the administration needs to be more aggressive protecting the vulnerable.
What we want to see, is more testing, more concentrated, focused testing, contact tracing. We want to see results, so rapid response.
Kelly and Stabenow are backing plans to force the administration to step up its reporting. The Trump administration now says a fuller picture of nationwide COVID-19 racial data will be published by early May. In Washington, Raquel Martin.
People with food allergies face unique and even dangerous challenges during this pandemic. Now a group dedicated to food allergy research and education has tips on how to help people with allergies navigate through food shortages. Washington correspondent Alexander Limon reports.
Shortages at the grocery store are forcing Americans to get creative with their meals, but those who suffer from food allergies don't have the same flexibility. Lisa Gable is CEO of the group FAIR, Food Allergy Research and Education.
Food allergy families already have a level of anxiety. It's never an easy process.
Grocery delivery services are popular as people practice social distancing to slow the spread of the coronavirus. But sometimes those services substitute items, creating danger. But there are ways people can help each other.
When people are in the grocery store and they're making choices, and if they don't, for example, have a dairy allergy, we're hoping that they'll leave things like those optional soy milks or almond milk.
FAIR says people can ask a manager at a store or food bank if they can hold items that are safe for them. An allergic reaction often means a trip to the emergency room. But with COVID-19 adding new risks, Tuesday, Dr. Tom Casale, FAIR's chief medical advisor, issued new recommendations to help avoid an ER visit.
Inject epinephrine, then call for help from a neighbor or someone else where you could be by the front door, unlock it, so that if you did have a severe reaction, someone else could still activate the emergency medical system.
Casale says people should speak to their doctor before trying this. In Washington, Alexandra Limon.
After being closed to non-county residents for weeks, most Utah state parks are now open to all visitors. That means all 4 state parks in the St. George area are back open to the public, and park managers are already seeing a surge in visitors. ABC4's Katie Krauss reports.
Over the past few weeks, park managers here in Southwest Utah have turned away hundreds of visitors every day, not only from the Salt Lake City area, but also from out of state. Now anyone is free to enter the parks here in Washington County, but park managers say they're keeping a close eye on their visitors. Park managers in Washington County say they're excited park operations are returning to normal.
From north to south, we want to be open. We want to be a location where people can come visit the outdoors.
Sand Hollow State Park Manager Jonathan Hunt says rangers are going to be actively monitoring visitation at their parks. And although they'll no longer be requiring proof of residency or issuing citations to out-of-county visitors, they'll be manning the gates to emphasize the importance of social distancing.
Come visit the park with the group you've been spending the last month with. We don't want groups of people, neighborhood groups, church groups, or school groups to come visit the park. We don't want people having events or weddings or parties here at the park.
With temperatures potentially reaching 80 or 90 degrees in Washington County this weekend, staff at Sand Hollow and Gunlock are bracing themselves for large crowds of people gathering to swim. Although they haven't kicked anyone out of the park yet for violating social distancing guidelines, park rangers will be staffed at popular areas to break up crowds of more than 10 people.
We will ask them to find their own solution to break into groups of less than 10 people, and they've been very compliant with that.
Katie Krauss, ABC4 News.
Still to come, it turned out to be perfect timing for the census to move online for the very first time. How you can make sure you are counted next. The 2020 census is a crucial count to determine funding, political representation, and more for our local communities. Earlier this month, we did an entire show on the importance of the count, and this morning, we're returning back to that to remind you of the impact. Here's our discussion with State Data Center Coordinator Mallory Bateman. Mallory, great to have you with us. Let's get right into Census 101. What is this all about?
So the census is a once-a-decade opportunity to count everybody living in the United States once, only once, and in the right place. And it's very important for our political representation, both in DC and down at the local level, for our allocation of funding, which we can get into a little more, and then also for looking into the future. We're a state that's always had growth, and so being able to have a new baseline starting with 2020 helps us look forward.
Let's get into more specifically why this really matters to Utahns here in our state, because it really impacts us in many different ways. Let's start with education. Talk about how it impacts education in the state of Utah.
Yeah, so education, obviously, I don't know if everyone knows this, but we're the youngest state in the nation. We have a lot of kids compared to other states, and so we have a big chunk of our population that we need to know how old they are. We need to be able to have that baseline of kids, and then it helps with planning for new schools. Districts can look at their growth and try to look forward into the future using that 2020 baseline. But because this is a count of everybody, it's a little different than some other sample-based efforts.
Yeah, education obviously obvious here in the state of Utah given the large amount of kids. What about infrastructure, the roads we drive on?
Yeah, absolutely. So one thing that is a local allocation of money is BNC road funds, and that is half of that allocation is based on census numbers. You know, if you look at Federal Transit Administration or other national funding programs, these numbers really mean a lot to being able to fund these road projects.
Healthcare also an obviously important issue in our lives. We're seeing that now more than ever. Talk about the impact on healthcare.
Yeah, so I mean, one thing that's really important, and there have been a series of studies from the George Washington Institute of Public Politics, and they've looked at how funding breaks out in states.
Okay,
and
right there.
across every state, Medicaid, Medicare is the biggest allocation from the federal government, and that's the same in Utah. Also, children's health insurance is funded in Utah using those census numbers, so a lot of funding comes into the state, as well as our big medical systems using these numbers to kind of look at their baselines and figure out what they need to serve their communities.
We're going to get more into the economic impact in more detail in a little bit, but talk briefly about business development and the impact the census has on that.
Yeah, so business development, it's kind of similar, and I'm a little bit outside of that typically because we're normally in the government realm, but you know, businesses need this information to plan for their services, to plan for new branches or locations, to figure out who they're serving and what's the best way to reach out and interact with the community.
And we talked a little bit about political representation. Our representatives are based on population.
Yeah.
Are we potentially looking at maybe adding another seat this year? I've heard we're probably not to that point yet, but talk about that.
I haven't seen anything showing Utah gaining a seat. Interesting, other states around us, like Colorado is kind of projected, and also Montana is projected to gain another representative, so they've been working really hard up there. But down at the local level, this is going to impact politics from our state senate all the way to like city council, school district representation. You know, we've had so much growth in the Wasatch Front. We've added almost 450,000 people throughout the state. And so it's mostly been in the Wasatch Front that growth has occurred. And so within the Wasatch Front, you're going to see changes in districts through the redistricting process in 2021.
Okay, let's get more into how this all works. Who should be counted in your household?
Everyone living in your household as of April 1st should be counted. You know, one hard to count population, interestingly enough, is kids 0 to 5. People seem to forget to count their little children, so remember your little kids. But you know, if you have a non-traditional household, if you have multiple families sharing a household, everyone should be included on your response form.
Okay, that's a really important point because April 1st, Wednesday, April 1st is Census Day. That means if you filled it out before or if you fill it out after, you're going back to the 1st on that day to make the count, right?
Yeah, and that's kind of your point of reference for all of this data. You know, it could be any time in the year, but April 1st was when the Census Bureau decided to have be Census Day. And so that's where everything should kind of be centered around.
Got it. So here in Utah, we have lots of missionaries out in different parts of the country, the world even. It's my understanding you do not count a son or daughter who's on a mission.
Right. If your son or daughter is not living at home on April 1st, they should not be counted in your census response. If they're serving in another state, they would actually be counted in that state. So, yeah, they're a special population just to Utah that a lot of other states don't have to interact with.
Yeah, that's for sure. All right, let's talk about how to participate. It's easy. I've already done mine. I just jumped online and did it. That's really the most simple way to do it.
Yeah, and it's available online for the first time ever, which with everything else going on right now is actually very convenient. So you just go to my2020census.gov and you submit your answers. For my household, it's only 2 of us, but it took maybe 5 minutes. There are also some phone lines you can call, and both the online form and phone lines are available in English and 12 other languages. If you wait a little bit longer, you might get a response form in the mail, but for the most part, try to respond early using the online response or the over-the-phone response.
Okay, and real quick, we have about 30 seconds left. If you do not respond, you might start seeing people go door to door, but I understand that's been pushed back due to the coronavirus.
Yeah, so it's been pushed back about 2 weeks at this point. We'll see how that all unfolds as everything else keeps developing. But just get your response in. It's easy, it's quick, and it impacts us for a decade.
Okay. All right, so really the best way to do that is online, and then you don't have to have people coming door to door, and I believe that's been pushed back to mid-May at this point through August. So we will see how that develops. As you mentioned, we're pretty lucky to have it online for the first time this year, given what we didn't know was coming our way.
Yeah, it was an exciting development anyway, but now that we have this outside circumstance, it's really convenient, and hopefully will make it easier for people to respond.
All right, Mallory Bateman, thanks so much for your time. We appreciate all your knowledge on the census. Thanks for being here.
Thank you.
Now, since that interview aired, the door-to-door count has been pushed back even more. We'll be right back with a look at what's coming up in the world of politics. We leave you now with a look at what's on the radar in the world of politics. The primary election is just a few months away now. Voters will pick party nominees for a number of races throughout the state on Tuesday, June 30th. The winner of those races will then move on to the general election on Tuesday, November 3rd. Make sure to connect with me on social media. I'd like to know what you think of this show and other issues that are important to you. You can email me or you can follow me on Facebook and Twitter. Thanks so much for making us part of your Sunday morning. We hope to see you again next week as we go inside Utah politics.